Health Minister Jonathan Coleman. It's nice to have you with us.
Good to be here,
on
John.
Checkpoint. Thank you. What do you make of all of that?
Well, look, I've got every sympathy for those people who we have heard from there. I mean, clearly they've had unacceptable service. But look, the big picture is this DHB was the worst in the country, and that is why I sacked the board back in 2015.
Financially the worst in the country, right? They had the biggest
Financially the worst in the country, but I tell you what, if you don't get the finances right, you can't provide the clinical service people deserve. And this has to be turned around. Those people should get their operations within the specified time. So things have got to change at Southern. There's a couple of departments there which I think need a real focus on clearing those waiting lists. We heard there from the urology or cases related to urology. Chris Fleming, who is doing a very good job as the CEO, as is the Commissioner, they are going to be receiving a review of that department. They tell me actually that of 10 patients who are waiting variable times for urgent radical prostate surgery, half of them now have waiting times, but they've got to do better. It's unacceptable when people are not getting their surgery within the waiting times that they should.
We've just received this email from a person who wants to remain nameless. I'm 57 and after repeated high PSA tests and DRE, which is digital rectal examination, late last year, which showed my prostate was enlarged, and the fact my father passed away from prostate cancer, I was put on the urgent list for a biopsy in January. I chased up repeatedly and finally thought I was getting my biopsy about 6 weeks ago, but it turned out to be just 10 minutes with a specialist designed to screen out non-urgent cases and reduce the list. So this man has a family history, he has an enlarged prostate, and he has high PSAs. He still hasn't had a biopsy.
Yeah, and that's unacceptable. So the DHB needs to explain why that's happening, and those answers need to be provided in the review. But the key thing is, people like that gentleman, they have to be getting their surgery, their testing and then their surgery in an acceptable time, because there's been plenty of money going into the DHB. We use the same funding formula for every other district health board in New Zealand. Other DHBs are able to manage not only within their means, but crucially provide the surgery when people need it and within the specified time frame. So that's not acceptable.
Yeah, okay. Let's talk about what the doctors themselves are saying.
Yeah.
Because, look, we've spoken to the CEO, and he was in that package, Chris Fleming, and he talked about an inadequacy of ICU beds, he talked about excessively long waiting lists. We spoke to the Commissioner that you appointed 2 years ago, who conceded that people were waiting too long. We spoke to the Medical Officer of Health, Nigel Miller, who says things aren't as he would like. But what we've obtained today is an internal document sent by a group of senior doctors in April talking about the completely predictable nature of this crisis. Inadequate theatre access in Otago. Some patients have little chance of getting an operation. They describe it as a slow motion train crash, and they say it's unfathomable how this situation has been allowed to continue. Now, it's all very well to say something is going to be done, but when?
So things are being done, actually. If you look at the number of operations in Southern, they've increased by 33% over the last 8 years.
Minister,
more surgeries all the time. Now, ICU beds, John, let me just finish on ICU beds. So there's 9 available ICU beds. Chris Fleming has a plan.
8, we're going to 9 at some stage next year.
8, they've just approved the 9th. No, they'll be going up to 18 next year. They'll have the capacity to go to 18
My understanding is they're going to 10 next August, right? No,
what they've told me is they will have the capacity as needed to expand to 18 on an as-needed basis in August. I've just got off the phone to Chris Fleming. He's confirmed that.
Okay, well, Chris Fleming said to us 10 last week. So
no, but there's another 8 HDU beds that they can turn into ICU beds when needed. Now, clearly, with these patients we've just heard from, I would expect those HDU beds to be used as ICU beds. So there will be a doubling of the ICU capacity at Dunedin Hospital by August. That's a pretty big increase, and that will avert a lot of these issues. So you asked what's being done? That's what's being done.
Within a year.
And that's what counts for the public.
In the meantime, cardiac surgery is being postponed. Surgeons are writing internal memos saying they can't do the work. I want to read
cardiac surgery, okay. So Southern implementing a plan to get all those people treated, and I insist that they do that. Same with the prostate surgery. Those people have to have their surgery. The public need to get the treatment that they deserve, because there's plenty of money there. Just the management needs to get their act together to deliver services. And this is the whole reason I had to sack the board in the first place.
Okay, but you put your commissioner in June 2015.
Well, she's got a huge task.
Well, hold on a second.
No, she has got a huge
If you
task.
sack the board and appoint a commissioner,
Yeah.
when is she going to start delivering?
She is.
Well, she's not.
No, she's no, John.
Look, her
John,
surgeons say she's not. The patients say she's not.
No, they're not saying that. She's totally delivering.
Well, what?
Okay, so there's two aspects.
Look, sorry,
John,
Minister. Have you been listening to Checkpoint over the past fortnight?
Yep, I've heard all that stuff.
Did you hear that piece we just played?
I was in Dunedin last Friday talking with people about this issue.
I don't want to have an argument with you, and
I'm
we
happy
really
for you
appreciate you being here.
No,
but I cannot recall such a sustained attack on a public hospital in my career in journalism, which stems back to 1989, than what I have heard from patients and people who work at the DHB over the past fortnight, and they are consistent in their thesis that they don't have enough money.
Well, look, John, that is not correct. The money has gone up by $40 million last year, an extra nearly $250 million over the last 9 years. The budget now is $923 million per year. It's not a matter of money. The Commissioner's done a very good job. She has halved that deficit from $42 million to $21 million this year. It'll be $14 million this year.
How did she halve the deficit? That's
She's
the
actually,
you've given her financial KPIs, haven't
yep,
you?
But it's not at the expense of patient care. Patients come first. That's absolutely. I'm in this job.
Why are
John,
you the only person who was saying that to me?
No, John. Other people are saying that as well. Patients come first. Look, I wouldn't be doing this job as Health Minister if I didn't have a deep and very sincere dedication to providing better health services for New Zealanders. That's what we focus on every day. Across hundreds of health services across the country, you would struggle to find more than a very handful that haven't improved. Now, obviously, urology in Dunedin is a problem. It's been described to me today as a toxic department. They've got to sort their act out there. They've got to provide the radical prostatectomies, the urgent testing that people like those, really good down-to-earth New Zealanders we've just heard from deserve and should get.
Right, so urology's a problem. Ophthalmology has been a problem in the past. You talked about people waiting for cardiac surgery. ICU is a problem. Tell me what parts of the hospital are going as you would like.
Look, the whole thing needs to improve. That's why we've put the Commissioner in. But this is a big, complex service.
2 years ago,
Come
Minister.
on, John. Look, you can't
2 years
go like
ago,
that.
you sacked the board.
Yep.
You put in a Commissioner. You gave her financial KPIs, and she has halved the deficit. But
job.
as everyone we are talking to is saying is to us, at a cost.
No, John, look, the patient care comes first. Her job is actually to get the finances in a stable condition. The reporting under the old board was up and down. Their figures changed all the time. She's doing a much better job than the old board. But the key thing is, without that clear picture of the finances, you cannot improve patient care. And the big thing is, we're going to be rebuilding Dunedin Hospital. So the indicative business case, is being considered by Cabinet. There will be a new state-of-the-art hospital in Dunedin. There's no question things need to turn around.
When?
Now, when?
When?
Well, look, you'll see it when the indicative business case is released, and I can't preempt that. But I'm quite happy to come back and talk to you here about it.
Yeah, okay. Can we look at a text we just received? My husband has to wait 40 weeks for an MRI to rule out a brain tumour as the cause of hearing loss in one ear. Now, this goes back to what the surgeons are saying in that internal document in April. They are not able to do very basic work, because if they assess that person had a tumour, they would then have to do something about
but John,
it.
that's a little bit unfair. We don't have the context around that case. If that person would like to email me at Parliament, I will personally look into that case.
Okay, can I read out from that letter again? A full-time general surgeon in Dunedin operates twice a month in the operating theatre.
Sorry, who's this
Twice
letter
a month. This is an internal letter sent in April to senior managers at the DHB from senior doctors at the hospital saying, we've had a guts full. This isn't working. It was leaked to us today.
To be quite frank with you, I struggle to believe that a full-time general surgeon is only doing 2 lists per month. They'd be doing 2 lists per week. Are you sure you're reading that?
2 lists per month, operating twice a month.
Well, we need to look into that because that just doesn't sound plausible.
Okay, the CEO of Mercy Hospital told us that every time somebody is stood down because of an inadequacy of ICU beds, the surgeon, who is very often prepped and ready to go, does nothing that day.
And that's why the ICU beds are going to be doubled in capacity
by when?
By August.
By August of next year. A year away.
25 million.
A year away.
John, 25 million being invested in these services in Dunedin Hospital to keep them going prior to the rebuild. A doubling of ICU capacity. Oh, look, I agree with you. Those stories we've heard are unacceptable. And that's why Chris Fleming is taking action. That's why the ICU beds are being doubled. And the wider context of that is we're rebuilding the hospital. There's an extra $250 million of funding that's gone in, and surgeries, elective surgeries, have increased by 33%.
Minister,
over the 8 years, well ahead of population.
Yeah, absolutely.
Yeah.
But you and I both know that the elective surgeries that have increased by 33% are the smallest and easiest ones to do.
No, that's not correct.
That is absolutely correct.
It's not correct.
We're talking about trouble at the heavier,
No, that's not correct.
The more surgical end of the hospital.
All elective surgeries have increased. They have.
Are you happy with what's happening at Dunedin Hospital?
I want to see great improvement. I'm not happy when, let me think. I'm not happy when the people of Otago are having to wait, and the people of Southland are having to wait for surgeries that they should get within a reasonable time frame. That's unacceptable.
Why are they having to wait? If it's unacceptable, and thank you for saying that, why are they having to wait?
Well, look, we're going to find out quite a bit out of that review of the urology department. Clearly, the hospital has not been working as well as it could over some time, and it needs to turn around, but it's not a matter of money.
It's not a matter of money, because everyone else we've spoken to, including the urologists, tell us it's a matter of money. Chris Fleming said,
and you know
when we spoke to him about the ICU beds, we need the money.
Well, he's getting the money for the ICU beds. So you're talking about elective surgery. As I told you, the ICU capacity is being doubled by August next year. That's a huge increase, 25 million going into that, and a huge hospital rebuild, as well as $250 million extra going into that DHB over the last 9 years. And I can tell you the other thing, John, every other DHB around the country is managing to deliver the operations that are needed. This has been the Cock Case DHB. It can't be turned around in 2 minutes.
Okay, let's look at your media statement when you appointed the Commissioner back in June 2015, Health Minister Jonathan Coleman, who was sitting beside me now, and I'm delighted to have you there. Well, I'm very sorry about that. Yeah. Your predecessor, this was you.
Yeah, it was me.
Has today written to Southern DHB dismissing all members of the board and replacing it with a Commissioner. The financial problems at Southern DHB are long-standing. I do not have confidence that the current government arrangements are suitable for delivering on the changes required in Southern DHB.
Absolutely correct.
Right. Yep. But you were driving monetary KPIs, and you said jump, and they said how high. And what we are seeing here is a direct result of your imperatives to reduce the deficit.
No, it's not. Look, the first thing is, John, you could not have the DHB continuing on that financial footing. Every month the figures we got were different, so you could not plan clinical care. So there's a number of steps to sustainability. It's financial, but it's clinical. The patients come first, it's the workforce, and it's the quality of services. And that's exactly as the Commissioner, I'm sure, would have told you yesterday as well.
We've got 1.5 minutes until 6 o'clock. Katrina's just reminded me that it's impending by walking in behind us. Welcome, Katrina. Can you tell me what people should do in the interim? Paul Schofield, for example, who has been waiting months and months and months for surgery. All the people we've spoken to, can you use Mercy more?
Well, look, the DHB has to have a very clear plan for getting those who need surgery, the surgery they need.
Is that an instruction from the Minister?
Oh, no, they know that. That's how it operates.
But they seem to both know it and not been doing it. What did you say to him today? Did you instruct him to spend more money to get work done?
No. Look, he's got as much money as he can, but look, he is an excellent chief executive.
As much money as he can, but not as much money as he needs, Minister?
No, look, I know this is your central argument, but it's not correct. He's got a turnaround plan for all those services. He's going to turn around that toxic urology service. And he told me today, look, the numbers of people waiting for surgery has halved from 10 to 5 for that radical prostatectomy. So he is the man to turn it around.
Overnight? How did that happen? I'm confused about that. Have some people just been removed from the list? I mean, the thresholds keep...
No, sorry, let's be clear. 5 of them have got dates, 5 are still waiting for dates.
Okay. They got dates today?
Oh, no, I don't know when he gave them.
They got dates since we raised it, Minister. That's good, though.
Well,
dates
I don't know if that's the case. But look, you're getting into a heck of a lot of detail. The big picture is there is enough money there. The Commissioner's doing a good job. We're rebuilding the hospital, and actually surgeries have gone up by 33% over time, and an extra nearly $250 million into the DHB. But performance needs to improve because patients come first.
Health Minister Jonathan Coleman, thank you for joining us.
Thank you, John.
Thank you.
Cheers.